Hai, saya Danas. You perasan tak gambar-gambar mak ayah kita dulu susah tu nak senyum? I mean seriously, look at that. Family photos are supposed to look like that. Macam baru meninggal ke apa? Every photos looks the same. No one smiles. So, saya adalah buat kajian sendiri through Google. Yes, anything Google says it's true. So, kajian telah menunjukkan banyak faktor menyebabkan orang tak nak senyum in the past. Antara sebab utama adalah most of the ways of smiling, the culture referred back to the old classics painting. This was the benchmark of smiling, also the essence of beauty. Another factor will be photography was somewhat slow. Okay, dulu bila nak ambil gambar tu exposure lama, jadi orang pun kalau suruh senyum lama penat kan. 1, 2, 3. So orang pun tak larat nak senyum, they end up not smiling at all. Kalau nak senyum susah, imagine nak suruh senyum tunjuk gigi, lagilah. Even up until now, if I were to ask my own mom, so kalau suruh senyum, Ma, kalau senyum tu boleh tak senyum nampak gigi sikit? Ish, hampa ni, tak senonoh tau, nampak keloloh, malu mama. But now, as you know, photography and camera has evolved in so many ways. Kamera sekarang dah laju, kita ambil digital, and ever since smartphone has been revolutionized,
and we are calling it iPhone.
Everyone wants to take a photo, everyone wants to take a selfie. Semua orang nak ambil gambar dengan senyum besar. They take selfie at the top of the building. Ambil senyum gambar with animals. Selfie ramai, they call it Wi-Fi. He smiles, she smiles, he smiles, everyone smiles. Ada juga yang senyum dengan kebakaran kat belakang. Maybe not a good idea. So today's topic will be something that is close to heart dan saya sendiri suka. I believe it's the essence of dentistry. Yes, today's topic will be rahsia senyuman yang cantik. So daripada pandangan depan, selalunya doktor akan nasihatkan, oh you ada low smiling line, you ada high smiling line. So what is that about? Apa benda tu? When we talk about smiling line, we're talking about the relationship antara bibir dan gigi, okay? Bila you all senyum. High smiling line adalah gummy smile, okay? So bila you nampak banyak sat gusi, we call it gummy smile. Low smiling line adalah bila you all senyum tak nampak sangat gigi atas. So ini adalah sangat subjektif, but usually the standards are untuk lelaki bila you senyum nampak seluruh crown, seluruh gigi, permukaan gigi tu kita boleh nampak. But for girls is up to 1 to 2 mm of gum margin boleh nampak. Usually we would like to have the whole crown nampak sebab you tahu kan kita semakin lama semakin tua. Studies have shown that for every 10 years your upper lip jatuh sebanyak 1 mm. Itu pasal bila kita dah tua, kita dah tak nampak kita punya gigi atas. Which is the reason why every time orang suka buat botox dan cucuk kat upper lip. What do you think that's for? Is to accentuate the upper lip so that dia naik terangkat ke atas and bila senyum nampaklah gigi. But you perasan tak kalau yang buat botox tu selalunya dia macam dah tak ada expression. You senyum pun bibir atas it hardly moves, dia tak gerak pun. So it's not natural, but there are ways for you to do it naturally. And you tahu tak, actually we can do that without having to do crowns and veneers. We can just do it with braces.
No way.
Yep. But how does it work? It's because you tahu kan, when we move teeth, we also move bone. And when we move bone, kita pun gerakkan juga gusi. And you know that smiling is not a straight line. Our smile is always a curved line. So susunan gigi kena ikut curve of your lips. Kalau tak nak you senyum, tapi gigi straight, it just looks so flat. It has to be in harmony with your lower lip. That is the smile that we want. Gigi tu bila susun kita nak sekembang yang boleh. Okay, we expand the teeth as much as we can so we get a very broad smile. Gigi geraham belakang tu kena nampak juga. Okay, it's not just up to your first premolar. Because anything back yang tak nampak, dia akan nampak hitam. And this is what we call dark buccal corridors. And bila you ada, dia nampak tua. And you don't want that. And so how do you know all this? So make sure bila dentist tu datang, before you start treatment, the dentist should always take a photo first. Because macam mana you nak tahu sebelum dan selepas, what is your reference point? Okay, so a real craftsmanship, a true artist would actually take a photo first, because then you all boleh buat comparison before and after. After much debate for many years, doctors have decided that there are many kinds of smile. A diplomatic smile, forced smile, and you have dynamic smile. The benchmark is always dynamic smile. Maksudnya senyuman bila you are gelap, because that's when your true smile appears. Now we're going to talk from your profile, daripada pandangan sisi, okay? Maybe you tak nampak tapi orang lain boleh nampak. So usually dalam kes gigi jongang, you have to understand kita bukan sahaja treat gigi, kita kena treat muka juga because usually bila kita buat rawatan, your face will somewhat change. One of the biggest mistake dentist selalu buat lepas buat cabutan gigi untuk kes gigi jongang adalah dia akan letak paucin serta-merta dan tarik semua gigi belakang. So what that causes ialah you punya arch boleh bengkok. Arch bends, what happen is that you punya bahagian depan akan jatuh ke belakang. So that exposes your gums even more unnecessarily, as opposed to sepatutnya lepas cabut gigi tu, gigi taring tu tarik ke belakang dahulu dan kemudiannya kita akan tarik perlahan 4 gigi hadapan ke belakang while maintaining dia punya angle ke hadapan. So that way kita hanya gerakkan gigi ke belakang, okay, that way, and not tilting it inside, because patient tak tahu apa sebabnya, but they know something is not right about the smile and they will say, I did my braces but I'm just not happy with the smile. So we have standard angles that we try to achieve. So sudut gigi atas menentukan kedudukan bibir juga. So if it's very straight or it falls back, you punya upper lip akan jatuh and you will get what they call low smiling line. You don't want that. But then if it's too much prokelan ke depan, tak nak lah pula kan nampak pula gigi jongang. So let's talk about your lower teeth pula. So it's very important to have an equilibrium. Equilibrium adalah kestabilan dan balance antara gigi bawah, hadapan dan juga your punya bibir. Okay, so if it's too much forward, then bibir akan tertolak ke hadapan. Same thing if it too much back, then you have what we call a lip trap. Bibir bawah akan stuck di antara gigi bawah dan gigi atas. One of the key points saya tahu if your lower teeth is too much forward ialah you menampak patient susah nak tutup mulut, and then every time you tutup mulut you nampak terkerut tau you punya chin ni. So it's not supposed to be so difficult for you to close your mouth. So we look at your profile x-rays, which we call cephalometric, and from that we have measurements, we have angles, we look at that, we assess soft tissue analysis, we know how much it can affect your face. We make your nose look bigger, we make you look older, especially hidung. Hidung adalah antara struktur yang masih continue untuk membesar, especially untuk perempuan, bagi mereka yang dah hidung mancung tu kan. Jadi kalau kes gigi jongang, kita tak nak tarik banyak sangat, sebab if you have a flat face, what happens is that nanti diorang nampak hidung besar. Be very careful, not in all cases that we actually cabut. So we take x-rays, we draw angles, and all of this would give us ideas on how to treat the patient. Someone actually asked me if it's okay kalau you buat braces bukan pasal gigi jongang, hanya nak gigi lurus saja. It's fine. At least it's somewhat more natural daripada you all gigi dah cantik tapi tambah veneers unnecessarily on top. So I hope you all faham, and if there's any questions, please do leave a comment. That will be all from me, Dr. Anas. Till then, bye.